welcome to the US Open Health Desk, brought to you by Mount Sinai. I am your host, Shauna Ryan, and joining us today is Dr. Alexis Colvin, orthopedic surgeon at Mount Sinai Health System and Chief Medical Officer of the USTA. Dr. Colvin, thanks so much for stopping by.
Thanks, Shauna.
So I want to talk about tennis as a lifetime sport. Old, young can play it. You can play it 365 days a year at indoor courts when it's cold out. So those players that always are on the courts, there really is an issue of burnout. And we're going to talk about that today and ways to avoid burnout. How would you define burnout for those who are watching?
Burnout is really exhaustion. So mentally, emotionally, physically, and that exhaustion can lead to distress, which then can result in potentially even giving up the sport.
How common would you say this actually is for players?
You know, it's a lot more common than we think, and the issue is that if you don't recognize the burnout, you can't combat it.
The mental side of things, you mentioned the emotional kind of mental stress. How common is that? How can you avoid that kind of a mental exhaustion?
Well, there's really a couple different ways that it manifests itself. Number one would be just focusing on the win.
Yeah.
Number two would be overuse or overtraining. And number three would be sort of lack of a social support system.
How do you avoid this then? Because it is easy to become monomaniacal, I think, when you become passionate about a sport like tennis.
Yeah, I think, probably the number one thing in terms of what professional and amateur players can learn is really to focus on liking the process. So not focusing on the win, but learning from their mistakes and enjoying the journey. In terms of overuse and overtraining, that kind of go hand in hand with the social support.
Yeah.
So getting out and doing non-tennis things away from the court, getting off social media and really doing something.
I love that you said that. Diversify, get out of social media, try some new things, like well-rounded.
Yes, exactly.
What about the physical side of things? Is there such a thing, in your opinion, as too much tennis?
Absolutely. If you look at the pros, they're not even playing 7 days a week. It's really important to take 1 or 2 days off a week from playing tennis and do something called active rest. So practice yoga, go out to the mall, anything that's not tennis.
Wow, 1 to 2 days also, that's normal. Because I know that people who are really passionate, they think, 365 days a year, 24 hours a day. That doesn't make you a better tennis player.
No, you're actually setting yourself up for an overuse injury if you constantly work the same muscles over and over again.
Is there a standard way to ensure that you're not overusing these muscles or overplaying?
I think there's a good way to do it. It's something called periodization, where you're alternating cycles of training with cycles of recovery. And a lot of times that depends on what your tournament schedule is going to be. So yes, there is a very objective way to do it, but it really you want to individualize it to the player.
Oh, Dr. Colvin, thank you so much for coming by today and giving us some great tips to help keep us healthy and on the courts and not to get too crazy when we're playing the sport. Thank you so much.
Thanks.
And thank you so much for stopping by. Don't forget to check out usopen.org throughout the entire tournament for more tips from our experts at Mount Sinai. Until next time, I'm Shauna Ryan. We'll see you right here at the US Open Health Desk, presented to you by Mount Sinai.